All right. Good afternoon, everyone, and thank you so much for joining us for the Clinical and Translational Science Collaborative of Northern Ohio. We are very excited to have two wonderful women who are leading in community health with us this afternoon as we launch the second year of our series, Fireside Chats with Leading Ladies. The Clinical and Translational Science Collaborative of Northern Ohio is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, MetroHealth, University Hospitals, and the Lewis Stokes Veterans Administration Medical Center, Northeast Ohio Medical University, and the University of Toledo. We aspire to be a catalyst for high-quality clinical and translational science and transformative research to positively impact the health of those in Northern Ohio and beyond. So today, we have the pleasure of learning about Dr. Lena Grafton, Director of Community Health Engagement at University Hospitals, and Romona, Brazile. She is the Executive Director of Community Health at MetroHealth. We are very fortunate to have Constance Hill Johnson. She is the owner of Visiting Angels and the first African-American woman board chairperson of the Cleveland Foundation. She will be moderating for us today. Without further ado, I'm going to give Connie the floor and let's take it away.
Okay, well, thank you so much, Jaleese. It is indeed my pleasure to be here. I love forums like this. I love, particularly when I get to ask the questions and I'm the moderator and I'm not the person being interviewed or questioned. So this is the fun part right here. Some of you I know, some of you I don't. I know we don't have a lot of faces on camera. That's how I am sometimes. So I definitely understand that. But I've had the pleasure of meeting Romona before and have worked alongside her. So I'm really looking forward also to getting to know Lena Grafton. I think it's Dr. Grafton. So just tremendously honored to be here. So of course we have some scripted questions for you all. Of course we do. It wouldn't be a program without having some scripted questions, but hopefully this will be more of a conversation and a little bit of a dialogue and not real didactic with me asking a question and you give an answer back. But let's start off a little bit with, I'm always curious, and I'm sure our colleagues are interested too, in your childhood, how you were raised. So, every success story starts somewhere. And so, Romona, let's go with you first.
Okay.
When you were little, what did you think you were going to be doing when you grow up? What did you want to be when you grew up?
So for me, when I was a child, and I grew up in Cleveland and the Lee Harvard area, and I think my family story is a common one of where my grandparents came here to make a better life during the Great Migration. We're a part of worked at Sherwin-Williams and the post office and the automotive factories. And so just a very blue collar, hardworking upbringing. And I always gravitated towards science and biology. And I think a big part of our family, a lot of our family members are in some form of healthcare. But I am the only one, or the first one, to have gone away to college and gotten a degree and became a nurse. So I always knew that I wanted to work in a helping profession, and one that was really in healthcare. But that it's a way that I see how we show love and care for one another in my family, as well as how we show love for other people. So for me, kind of just coming up in that environment is what pushed me towards healthcare.
Great. Dr. Grafton.
Yes, and so I am so happy to share the stage with the both of you, and so honored and privileged to be here today to share a little bit about myself. And very similar to Romona, I grew up on the east side of Cleveland, a native Clevelander in the Glenville area, and much to her background, my grandparents were part of the Great Migration as well, seeking a new opportunity for their young children as they took a train to Cleveland to settle here. And one of the things that my grandmother would always remind me is that she was going into the unknown. And all she knew was she wanted to do something better and different. And so they got into the manufacturing field that was pretty prevalent here in the state of Ohio. But even beyond that, as a child, I would remember watching TV with my grandmother. And one of the things that comes to mind when you ask me about what was my trajectory, or as a child, what I wanted to be, all I saw on TV, and they watched a lot of news at that time,
Mm-hmm.
was reporters. And they were talking about current events, and they were talking about things that were happening, not just in our community, but around the world. And so I wanted to be a part of that. Now, the thing that was very, now that I think back on it, that was very interesting to me is that although I kept looking at the news, I would hardly ever see anyone that looked like me that was reporting the news. And so that really inspired me to say, I can have a platform that I can share information far and wide. And this is something that I could do, even though I didn't see anyone that looked like me doing it. And so that was my first peek into what was my purpose and what was I meant to do.
Thank you for sharing that. Thank you for sharing that. We all know Oprah Winfrey. My goodness, we all know Oprah Winfrey. And one of the things she said quite a while back, is, what I know for sure is that speaking your truth is the most powerful tool we all have. And I'm especially proud and inspired by all the women who have felt strong enough and empowered enough to speak up and share their personal stories. That being said, made me think of asking you, what's your why? I think, Romona, maybe we got a little bit from you when you said you always wanted to serve and be in healthcare. So I'll allow you to expound, but let's start with Dr. Grafton first. What's your why?
Yes, let's see, my why. That's very interesting. And so I've been in public health for quite a while. I entered public health as administrative support, believe it or not. And my undergrad degree is in business. My master's degree is in public health, and my doctorate is in urban education. And if you looked at them independently, you would say, how does this all fit? But as I'll share with you my career trajectory, you'll see how it all complements one another. So I started out in business, and I immediately knew that this is definitely a field that's needed in this era, but I knew I was not the one to lead it. And so that took me on to public health. And I was seeking, and at the time I was working at a hospital, and I was seeking my place in the world. And what does that look like? How can I express my values while serving my community? Because that has always been an integral role for my family. As servant leaders, this is something that you do. And at the time, you don't talk about it. Actions speak louder than words. You just do it. And so from there, I learned about public health. And that's when I got my public health degree. But I just saw this big gaping hole of healthcare access and sharing of information, working in silos, seeing these invisible barriers. And it's almost like when you live in Cleveland, if you're an East Sider, your car doesn't naturally go to the West Side. And if you're a West Sider, your car doesn't naturally go to the East Side. So seeing these invisible barriers that many of our communities have that were needless, that there was no real true explanation of why they existed other than it helped to create a burden.
Mm-hmm.
Or that's why we have our health disparities. So I knew that that was my true North Star, that these are people who are so well deserving to thrive. It was not their I will say fault in air quotes that the community was under-resourced. It was not invested properly. And so now you see the remnants and the consequences of that. So from there, I knew that my why was, why are some people overly burdened with not only healthcare conditions, chronic conditions, but why are they overly burdened with economic and social issues?
Right.
And so these were the driving forces that really kept me moving in the direction of how can I serve? Where are the areas that I can make a difference? And not only that, where is the opportunity for this collective impact? How are we enriching our communities through equitable practices? And so that is my why.
Thank you. Thank you. Romona.
Thank you. Thank you so much. And I think Lena and I have something in common, just in even listening to her speak. And I got to meet Lena a couple of months ago, and we're saying, you know what, I found you now, and we are connected, and we are going to do this thing together. So excited to be on the panel, but really looking at, sometimes it doesn't make sense. Like when you kind of understand your purpose and what your passion is, it sometimes draws you in different directions. And from the surface, sometimes it doesn't look like it makes sense. Like you just said, you had these 3 different degrees, and sometimes people don't understand like how you connected it all and how that impacts your life. For me, I have a nursing degree and as well as a communications degree. And for a lot of folks, that is like, why did you get a communications degree after a nursing degree? But to me, it made sense. It makes perfect sense. But really, I can tell you that I remember I always knew I wanted to work in labor and delivery and in community, and I wasn't sure which one. I started my career in labor and delivery. So a primary passion of mine is maternal child health well-being. And but community has always been a part of that too. And I remember I worked at a public health department for almost 20 years, and I started as a case manager, and I had a home visit with a family, and I still remember this home visit. I remember going, if I rode down the street in Cleveland Heights today, I would be able to point out this house because I feel like it changed my whole life and what I understood about myself and my purpose. And I was visiting a family that had a child with elevated blood levels. And, you know, I had come with my folder and my papers, and here's the grants, and here's the what you got to do. And who I met was a grandmother who was taking care of 4 kids, and they were 6 and under, with the youngest being 2 months. And, you know, the first thing she said to me when I sat down at the table with her to go through my nicely prepared everything was, "We don't have enough food." And at that moment, I felt like my whole career changed because I understood that if I really wanted to make a difference, then I needed to understand more about the people who were being impacted, what is important to them. And are we addressing that? I came in here with an agenda. My agenda wasn't the right one for the day. You know, it changed when I left there into, I got to find food for this family. I got to find help for this grandmother. I don't know what has led to her taking care of 4 children under the age of 6. But I know that like my purpose needs to be, how am I going to help address and solve this? And then I'll tell you about another home visit I did. And I was another child that was had elevated lead levels. And one of the things that we used to do is and they still do is loan out vacuums with HEPA filters to help capture the dust better. And I went there, and the house was essentially, the roof was falling in, and the ceiling in the room we sat in was falling in. And I was looking at this vacuum like, what is this this vacuum's not gonna do nothing here, you know? But it told me that this is a bigger issue. You know, this isn't about one family in one house. This is about how this is designed, how this is implemented. This is a housing issue. This is you know, looking at the social drivers of health and access to food and the social support. This is a bigger issue than what I've come in to address. And if I really want to see a change in that, then I have to step back a little bit and look at how do we address these things from a larger lens of how we help change conditions, how we work at policy and system levels, so people have access, and that it's a justice issue. So I really do look at the kind of work that we're doing as being a part of a fight for justice for people.
Great. Wow, such profound answers from both of you. With the overlap, I could see the overlap, and I could tell why you decided to join forces, and you probably knit yourselves together for eternity doing this work. So good to hear. But you know, I want to be mindful of time because I know there are going to be a few questions. But let me ask you this: if you had a magic wand, so think about it, ladies. If you had a magic wand, what is one challenge? And we all are passionate about community health, and that's why we're here. What is one challenge that you would make disappear for now or for the future of community health workers? And you cannot say just the generic health inequities. You can't say that. That's an umbrella that we know what falls under health inequities. Okay. So if you had this magic wand and you could say, Shazam, this is gone, and my job won't be as challenging. And for people coming into the field, they won't have to struggle like so many of us did because of this one issue. What would you say? Whichever one of you want to begin.
Ramona?
Okay, Lena. There's so many wands I wish I had. So you know, I think one of the biggest challenges that we face is how we really work together and partner, and taking those barriers down on that, because and really putting and centering what's best for communities as the goal, bringing together our assets and our resources that help to do that. I think we could accomplish a lot of things. You know, I think I've been around public health long enough to know that there's a lot of pieces and parts that need to go into supporting healthy, vibrant communities, and people having the opportunity that they need to live the life they want to live and be healthy. Because I think it's both of that. Sometimes we look at life and death and we don't think about living and vitality. And so for me, one of the biggest barriers or challenges is almost like getting outside of ourselves, outside of who I am as an individual, outside of who is MetroHealth as a health system, but who are we as in working together to bring those things. And that's partly why Lena doesn't know that we are connected. She knows because I told her we're going to lunch soon, but that really, we got to get outside of ourselves and be willing to tackle things together, and at all times. That takes work, and sometimes we get it right and sometimes we get it wrong, but that the commitment needs to be there to continue to do it. So it's, for me, it's kind of like always thinking about partnership and doing things in a way that's might be a little different than we did it before. But the reason I'm so drawn to community work is because I believe the community's voice needs to be centered in it. And it can't be what institutions or systems do to people, but what we need to do together with community, led by what community needs.
Great. Lena.
Beautifully stated, Ramona, and I ditto all of those comments. And if I could add something to that, it would be representation. Representation matters. And I just think about, in my current position and a few of my previous roles, I just think about stepping into rooms and being the only one, and or not seeing anyone with similar cultures or background or lived experiences at the table. And this is the table where they are making real life decisions for other people that do not have a connection or a true opportunity to understand it from a different lens. And as I think about my career trajectory, it was very difficult for me to see the next step because I didn't see anyone that looked like me in that next step. So there were a few, what I wouldn't call it missteps, but there were a few things that happened in my career only because of the lack of representation. And so if I think about what is needed or the magic wand that I would hold, of course, it's the DEI, but really offering an opportunity for that diversity of thoughts, of how people think about certain things, and being able to have a diverse group of people around the table making decisions where you have a group of different perspectives where all of them are important, but one single one is not the focus, but we're able to share in a way that's meaningful, not just to those around the table, but who the decisions impact. And so this is so very important. And I'm hoping that this magic wand happens sooner than later. And I'm doing everything within my sphere of change, influence of change to make that happen. So that's very near and dear to my heart.
Great. Well, one more question before I open it up. There are many more questions here, but you know, look into your, you move from your wand, look into your crystal ball. 5 to 10 years. Hey, where are we? 2024, let's say 2030. Let's even give it 6 years. Because things move so fast or so slow. Where do you see community health? What 6 to 10 years from now? Where do you see yourselves still with the same challenges? What do you see happening in the field of community health?
Oh, Connie, you have really opened up a vacuum. Yes, I love it. So to your point, one of the things that I would love to see, and you are a part of this whole movement, is having community members as part of boards. That not only is it, you know, in some instances, it's very typical or traditional, but I would love to see community members as part of boards that you don't see right now, because they lend a different perspective and they have a voice that oftentimes when we are presented with challenges, they already know what it's going to take to resolve it. And so I could see things happening at a quicker pace, and to have things really reconciled early on, because we're speaking and hearing from those who are living it, or at least have lived experiences related to it. So have community members on boards. That's one thing. Another thing is that I would love to see the landscape of Cleveland or Cuyahoga County change, that there are no disinvested communities, that everyone has all the resources they need to thrive, that everyone is working together in sync, knowing that together we are better. And these are things that I can imagine that they could happen sooner than later. But ideally, 2013, I would be okay with that. So those are just a few things that come to mind for me.
Great. I could tag that too. Ramona.
Yeah, and I think, you know, overall that just more integration of community into a lot of the things that we're working on in a meaningful way. You know, one of the questions I always ask when we talk about partnership is, okay, what do you mean by that? You know, like because sometimes that for some folks that means a logo on a something or a banner, but if that's not real, you know, it's like, are we really getting in and allowing that we're going to be different because of our work together? I like to think about it as, you know, we talk about like the table and, you know, bring your own chair, you know, Shirley Chisholm. And and then some people talk about building a new table. And for me, it's in a way kind of recreating a table, because we have a lot of the pieces and the parts there. You know, we have the wood and the hammer and the nails. But that table needs to include community there with us. It might be how we look at something differently, but that it's being co-created. It's not being created by itself, by a system or an institution. Lena and I actually were on a call this morning together with Cleveland Clinic, for example. And one of the conversations, one of the thoughts were, we need maybe less assessment and more movement. And I thought that is what
We need a t-shirt that says that.
Yeah.
And more movement, because I think a lot of community members I've heard directly, we don't need another assessment.
Right.
You know, we know what the problems are. This is what we think we need to be able to address and solve that. How do we work on that? And so spending less time saying what the problem is, and you know, I've heard other people say, you don't need to come to our community and tell us what the issues are. So it's really about, are we working towards solutions and doing that like in a quicker pace, because we've gotten over how to work together, but that we're moving. And I think that would be, you know, a great thing to see over the next 5 to 10 years is through that what is accomplished.
Isn't it amazing that, you know, for years and years, the researchers and the degreed individuals and the certified individuals were always making the decisions for what the community need and not having a clue about their lived experience. And now it's like within the past couple of years, everybody's had this aha moment. Like, oh, maybe we ought to ask folks what they really want and need versus us in our high towers saying what those who are having a different lived experience, but because we have all these degrees, we think we can tell them what they need.
Yeah.
And I think collectively folks are finally saying, we need to stop that. And I think it's because the community is pushing back too, saying, don't come into our community and try to tell us what we need or give us, we may not need this. I'll give a really quick example, and then we're going to open it up for questions. At the Cleveland Foundation, because we've moved our offices to be more proximate to the community, we had a lot of folks, residents from the Huff community, come to talk to us in the boardroom. So Lena, when you said that, it made me think of the residents who were just like, I am sitting in the boardroom of the Cleveland Foundation. But when it came down to say, just talk to us about what we could do that's easy, low-hanging fruit, do you know what it was? They just wanted a good handyman in the community who could put up a ceiling fan, who could put some rails on the basement steps. So for the older adult or the senior, she wouldn't fall going down. To come help them get the trash out of the flower bed. They didn't, it was simple. You know, I don't know what we thought they might say. They're like, and he or she could float, a trusted individual, could get that light bulb at the top that they couldn't get to. And so that would have never been on our list, that they wanted a handyman. Never. And so, but it was just a matter of asking, what do you need? What can we facilitate helping you get to meet one of your greatest needs? And it was just a trusted. Then I thought to myself, heck, I need a handyman too.
Me too.
So I just wanted to share that. But let's open it up for questions. We have quite a few folks on. So please, you've got 2 brilliant women here. I think we're all here because of our love for the community and being community health workers and committed to changing the conditions for so many of our peers and colleagues and residents. So here's your opportunity to ask of these 2 great women. So here's one. What's a recent win you've had? Someone put it in the chat. So whichever one of you want to start, what's a recent You know, we don't want to take up a lot of time, so kind of be brief, but what's a recent yes where you patted yourself on the back and say, you go, girl, you did that?
Well, I will point out the Women's Health Expo that was last fall. We and I have to give a shout out to Dr. Steed and her commitment to community and her expectation. And that's how I put it. It's an expectation that we work with community, we're out in the community, and we're working in partnership. So the Women's Health Expo, we had less than 100 days to pull that together, and it was a lot of stressful days and nights and weekends. But what I loved about it, the actual day of, was it felt joyous and celebratory and vibrant, and it of course was bringing resources and health screenings and those types of things to the community, but it was a celebration of women. And I just loved that atmosphere of seeing that, because a lot of the things that we deal with they're very heavy, and you don't need to be told every time, about your higher chances of dying from something. And that happens a lot. But this idea that we can bring what people need to a space, and we can also celebrate and have joy. And so that felt good after it was over.
Yeah,
That
yeah. After I helped out a little bit with that. That was
Yeah.
a heavy lift in a short period of time, but it was a huge success. Dr. Grafton, what's a win for you that you are still smiling about, that still brings you joy when you think about it?
Yes. So, and kudos to you, Romona, and your team for the expo. Great execution, great programming. And so, as I think about needs of the community and community health, one of the things that I was able to co-lead at University Hospitals is our community health investment strategy. So we are lifting up 3 priorities, that is maternal child health, economic opportunity, as well as well-being. And so one of our signature initiatives I was able to develop and bring to fruition. So we currently have 2 wellness centers. One is in Bedford, one is in Glenville. And these are opportunities for the community to come in for free to low-cost programming. And I call it a wellness program centering. And so there are the 4 F's. That's where you learn about healthy food options. We have a free cooking demonstrations where you learn about financial wellness, because that is part of being healthy, being able to provide a quality living and budgeting for your family. There is fitness. If you are not physically active, you are not promoting the best health for yourself. And then the 4th and final F is fun. We do that in a very welcoming and fun environment. So putting all those pieces together, offering a well-rounded experience at the wellness centers.
Great.
Another
No. Did you want to say more about that, or yeah?
I was going to go on to one other thing. So there's 3 things that I'm very proud of. So I can stop it too.
Okay, yeah, I'm happy to stop it too, because I see another question here, and I want to get as many questions in as we can. This is a good one, because we talk a lot about trust-based. What are the 2 of you doing to help build trust amongst the grassroots organizations that are out there? I always say the boots on the ground. The folks are day after day, face to face with the community residents. What do you see your roles as? What are you all doing to kind of build that trust, particularly when we're talking about collaboration?
Absolutely.
We talk about that a lot.
So first I have to say hi to Miss D. I've actually known Miss D for a long time. And before I came to MetroHealth, and I still worked at the health department. And we worked on a lot of different community-based work, but one of them was COVID vaccination in communities that didn't have access to our large mass vaccination sites. And Ms. D's group was certainly very pivotal in, hey, Ms. D, in making it and happen and connecting with community members. Now here at Metro, it's a focus of ours of how do we do better at this? Because I think first we have to start with and being honest, is that institutions and large institutions haven't done well
Mhm.
in working with grassroots organizations. And part of what my team talks about is there's always going to be the big organizations and groups that we work with, but part of how we need to evaluate how we're doing is by knowing who are those grassroots organizations in the communities, who are those informal leaders. They may not be even associated with an organized group, but they are feeding the people. They are making sure the kids get to school. They're buying the diapers, and we got to get embedded enough in partnership enough that we know who that is. Some of the things, but I want it to be meaningful, right? So it needs to be a two-way street. So some of the things that we talk about as kind of our guiding principles is we want to be present and consistent. And a lot of times that might be, are we coming to meetings and supporting the efforts of that group? It's not always about what we want, but how are we providing resources? And that's, our providers supporting the groups. It's the services that we offer. It's the funding that we have. So, we're looking at, and we have launched some mini grant programs for smaller organizations. We're testing that right now with some of our outreach for our the men's health fair that'll be on April 27th. But we want to grow that more. We're looking at our community advisory councils, which will launch this year. This is kind of a signature of Dr. Steed's. At that community neighborhood-based level, and really understanding what are the members and residents in those communities saying they need, and then how are we supporting that with actual resources or those services, those dollars. So for me, it's a work in progress, but it is a central part of our strategy, and to the point of it's necessary to build trust as well as relationships.
Great. And building trust takes time.
Mhm.
It's an investment of time. And so
It
many
is.
of us kind of wimp out after one or two meetings.
Right.
And we got to show up and then show up again and then show up again and then show up again.
Again, and I think we also have to apologize when we get it
Yes.
wrong, because we are. And when I think about relationships can withstand disappointments. And but when you approach it in a very transactional way,
Yeah.
where I'm just looking to get this and you're looking to get that, they can't withstand when things aren't perfect and right. But because these issues are so persistent, we really do need relationships over time.
Dr. Grafton, do you want to, and you don't have to, do you want to lean in on any comments specific to that?
Sure. Well, I agree with everything that was stated. Another component is making sure that because as part of being part of a healthcare institution, there is the opportunity for research, and making sure that we are providing opportunities for the community to understand how that involves them, and to have the most up-to-date information about research and building that level of trust. And so recently, I was just awarded, me and my team, Martina Pace. She is one of the community health managers for the academic region. She's on the call today. We were just awarded the READY grant, which is Research, Equity, Accessibility, Diversity, and Inclusion grant through the CTSC, Clinical and Translational Science Collaborative, where we are providing an opportunity for military veterans, as well as those who identify as Black or African American, to participate in a research that provides education around health disparities and why research is very important for people of color and those who are veterans. Because if we are not included, the results may not benefit us as it should. And so just debunking some of the myths, opportunity to build relationships at the grassroots level, and to share the importance of research. So I'll stop there.
Great, great. And I think particularly in communities of color, and I'll be specific in the Black community, the whole topic of being a part of research studies, because of our history. It's frightening, and we go the opposite direction, but it's going to take, again, that consistent education of why more and more of us need to be a part of these research studies as new procedures come out, as new medicines come out. If we're not a part of the study, then it's very, 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 very difficult to ascertain when new things come out, if it works for us. You got to be a part of the study to determine if the end result will benefit. So I appreciate the work you're doing, and kudos on winning that grant. That's great news. That's great news. As we begin to wind down, we still have a few more minutes. Think about, what keeps you going during those days when you just, because I had a day like that a couple weeks ago, and I'm not even directly in the same arena. I'm more on the periphery, but still connected to the healthcare arena. And it was a day where I say this unashamedly, where as a woman and as a Black woman and just so much on you, that I just had a good cry. I came home, and my poor husband, he just thought it was horrible news. I'd gotten news that somebody died or something. But I felt like I just wanted to let it all out. Just the concerns and the weights and what you're hearing day after day, and meetings, and having to collaborate on decisions and what's best for the community. And I felt like that commercial, remember? Calgon, take me away. That's really how I felt. So where do you turn? What do you do on those days or those moments where you're at your lowest low, or you're about to take a monumental risk that could skyrocket you one direction, or if it flops, you're concerned that everybody in the city is going to be talking about me.
Yes, for certain. And I think part of it, I just want to acknowledge the weight. First is in what Lena said, and in representation matters, and being at a lot of times one or two, or and being trying to be a voice that says, hey, all the time. Right. that is a weight.
Hold on.
And so for me personally, in kind of dealing with that, for me, it goes back to my why. And in keeping that centered. I think it also goes back to being assured in who I am at all times, because I think that things that happen around you, especially in community kind of work, your intention, your integrity, a lot of things can be questioned. And you can't be allow that to change how you feel about yourself. And so for me, I have to have I feel like I have to have a lot of self-assuredness in both what my intentions are and what my abilities are. And then the last thing I'll just say, because more from a spiritual or religious base, is I have to remember whose I am. So that part of what I think I'm doing is a part of a life mission, in an assignment. And so, why should I let someone deter me from my assignment? It's not theirs, it's mine. So it doesn't mean, like you said, there's still days, where I'm like, why am I doing this? Or I don't have to put up with this, kind of things. And some of them have been recently, but I do, I just kind of continue to center back to that why.
Good. Yeah.
Yes.
Lena?
Okay. And so kind of you are speaking to my soul right now, because we all have the days. We wish that they were few and far in between, but you never know. And so one of the things that my grandmother would always say, if you think you have problems today, just keep living.
Just keep living.
Just keep living. And so one of the things that, to your point, Romona, that I hold steadfast to is my spirituality, is that when things get rough, I know there's always an opportunity to give it up, that is not mine to own, that I'm working in my divine essence. And so some things, of course, if you're accountable, you own. But when it comes to the heaviness and the weight of it, that you really have to give it up at some point and turn it over to your higher power. And so that's the one thing that helps to guide me, especially because you know that it can get very challenging at times. And so instead of freezing, you have to keep moving, and you have to move in a way that is drenched in integrity and values that which is the foundation of how I make decisions, that it really has to be based on equity, ethical, sound decisions, and evidence-based practices. And knowing that you're doing the best with what you have. And so it's always searching for more information so you can make those informed decisions. And so I think that is what helps to keep me grounded. And then to have people around me that can support me, especially when there's a lot of noise that's happening. And that could be good or bad noise, but understanding that at some point you have to sit in it and get through it. So having those trusted ears that you can have, sound voices, mature voices that will give you sometimes nothing but silence, and sometimes opportunity for their wisdom and insight. And so I just keep those things around me. Great.
Well, unless we have any other questions, we've got about 5 more minutes, and then I'm going to turn it over as we approach our close. So let's, I don't see any other questions in the chat. So let's end on this one. As you look back over your career, what would you say is your most proud, the proudest moment in your career to date? You're going to have many, many more proud moments, but where you are now, what's the proudest moment of your career to date? Either one.
I would say living my purpose. That is my proudest moment. I just talked about not getting stuck in fear, moving past the fear, because it's not going to be the first or the last time that you have it. And so in order to continue that growth, you have to stretch. And sometimes stretching is painful. And sometimes stretching can come with its own challenges, but embrace it. And I've been so very blessed to know that as I look back, that I'm taking someone else with me. And it's not just about what you're doing on your own or the agenda that you have, but it's really having that broader view of what are you accomplishing and what are you helping others to accomplish?
Yes, thank you. And Romona, I think you'll have the last word.
Okay. So for me, I think my most proud moment was when I still worked at the health department, and in those initial days of COVID, and when after the vaccine came, so we were a whole year, and then it was, now the vaccine's here, and about a month or two into the vaccine distribution, really seeing like we are not getting to the people we need to get to, and we need to do something different, and kind of taking a stand on that, and saying we need to do something different, and forming a group that included community members, and Miss D was one of them, and working with the city and the churches, and doing some signups, and having in Metro at the time, and having our first like community-based clinic in East Cleveland, where out of the Salvation Army, and we vaccinated almost 400 people that day, and that one clinic represented more Black people that we had vaccinated than we had in 2 months of vaccinating people. And I remember, afterwards just being exhausted, because there was so much work to organize, and we were trying to get people there and organize rides and everything. And the governor actually came and the executive and those type, because it got so much attention at the time. Everything was so intense. But I just remember always using that as an example of things can be very hard. You know, a lot of things are very hard. And I was in a leadership role, so I also had to figure out what are we going to do. It wasn't just getting through it. It was also trying to lead other people through something when you don't have all the information yourself, and you're trying to make the best decision that you can at the time. But that you can do that, and you can get through something that seems impossible and still accomplish a very good thing. And that you can use that as fuel for the next thing. So that's part of why I believe these issues that we're trying to tackle can be tackled. Because when we get the people, we include the people, and we get behind the goal that we're trying to accomplish, even though it seems very difficult, it doesn't mean it's impossible.
Well, ladies, folks are thanking you both in the chat. I am grateful to have been asked to just facilitate this a bit with you. Jaleese, thank you. Hopefully I will, Dr. Grafton, get an opportunity to meet you in person one day soon. I know how to find Romona real quick if I need to. But anyway, I think I turn it over now to Zena Hempstead, who'll close us out. And again, a privilege to be here, and I hope to stay connected.
Thank you so much. Thank you, and Lena and CTSC, for this opportunity.
Thank you all as well.
So are we hearing from Ms. Hempstead or no? Or Jaleese?
Happy to close it out for us. So we hope you'll join us next week when we talk with when we have our next fireside chat with leading ladies. We'll be focusing on ladies who are leading in data. So the lineup here, that's Thursday, March 14th from noon to 1. And that'll be moderated by Dr. Elizabeth Crow. She's the Director of Urban Analytics and Innovation for the City of Cleveland. And we also hope that you will pin us in on Sunday, April 14th from noon to 4 at Cleveland State University when we host our first Black Maternal Health Equity Summit. Registration, food, and parking is complimentary thanks to our generous sponsors. And we have 2 on the call right now, University Hospitals and MetroHealth. So thank you, Dr. Grafton and Romona, for your support. And we hope everyone has a wonderful afternoon. Thanks for joining us.
Thank you, ladies. Bye-bye.